Okay, so you've had a breast reduction and you ended up bigger than you wanted to be. How long do you need to wait to have another surgery? So when you have a breast reduction, we do surgery and then you're going to swell for a couple days, and then over the next couple weeks the swelling will start to drift away. You're not really doing a whole lot in that first month. You're just relaxing, being normal in life, and then by 4 to 6 weeks about 70% of the swelling is gone. But once you start exercising and using your body more, sometimes you become more swollen, and it's just because you're using the area more. And this area has been damaged somewhat with surgery, and it doesn't process fluid normally. So it can be many months for this area to have all of the swelling to go away and the tissue to process fluid normally. So 6 weeks is a common time when this happens. So I always tell people, don't get too worked up about the size this early on. You really need to wait to 6 months for all of the swelling to resolve, to see what your final size is before you decide whether you like it or not. So you've made it to 6 months and you're just not happy with your size. It's bigger than you want. The first thing is to decide, how much bigger am I than what I want to be? If it's just a little bit, then liposuction is usually the answer. Now, liposuction is used to remove fatty tissue, not breast tissue. So as long as you have enough fatty tissue in your breast, we can usually get you down about a half a cup size to a cup size. And this is safe to do about 6 months after your initial breast reduction. Now, if you want to be even smaller than that, or you have just a lot of dense breast tissue and liposuction is probably not going to work well, then you do need more tissue removed. And this is where things can get kind of risky. So breast reductions are done in different ways, meaning that we leave the tissue behind that has the blood supply in different places in the breast, and we move things around in different areas. So if you are someone who wants a smaller breast in a short time frame within a couple years after your initial breast reduction, the safest thing is to always go back to the surgeon who did your breast reduction in the first place, because they know exactly what they did and they're more likely to be able to safely preserve the blood supply because, again, they know what happened in the OR the first time. Now, if you're over 5 years out, you can really do the breast reduction again in any way you want. So you can go to any surgeon you want. You don't even need your prior op report, in my opinion. The surgeon can just do the breast reduction in the way they think would be best for your anatomy. So that's kind of the skinny on, hey, what do you do if my breasts end up too large after a reduction? There's always options for you, but again, you always have to remember there's no perfect size. And so you have to do that risk-benefit thing. Is it worth the risk of an additional procedure, the cost of an additional procedure, to decrease your size as much as you want? So those are only questions you and your surgeon can answer together as a team. Hopefully this helps. Let me know if you have any more questions.